Now, no one would ever argue that MR should replace CT for evaluation of the mesentery. In fact, I would argue if there's any hint of a mesenteric abnormality, the best test is going to be a CT scan. But I'm showing you this example because I think it is important that you don't just ignore the mesentery when you're evaluating an MR. Often there can be important findings, and I think all too often we're so focused in on the parenchymal organs on MR that we ignore some of these ancillary mesenteric findings. Now, if you look at these images, whether it's the T2s or the post-gadolinium images, you can see that there's an abnormal soft tissue mass in the right aspect of the mesentery. There's desmoplastic reaction. It's tethering adjacent loops of bowel, which are showing some thickening and mural edema. And if you look at the CT images, you're seeing really a classic mesenteric mass with desmoplastic reaction. This is a classic example of a carcinoid tumor with a mesenteric metastasis. And you can see how this mass is tethering. It has desmoplastic reaction and mass effect in adjacent bowel loops, which are showing some thickening, probably as a result of lymphatic or venous obstruction.